Hi, it's Dr. Weiner, and I'm going to talk to you about doing temple filler. And as you can see in our patient, Marissa, she has hollowing in her temples, and this is typically found in patients that are extremely athletic and thin. They lose the temporal fat pad, and this temporal fat pad is contiguous with the preauricular area, so always look at that too, and she does have a little dip right there. We're going to address that at a different session. Today we're going to address the temples. And she has a pretty significant temporal defect, so what I'm going to use today is Defyne. I'm going to dilute it with a cc of saline and a cc of 1% lidocaine. When you do this, you got to tell the patient that they're going to be unable to lift up their eyebrows for approximately 30 to 45 minutes. They'll think something has gone wrong, but it hasn't. So clean her off, and I'll show you how. So I have added a cc of lidocaine, a cc of saline into this, and this is Defyne right here. And I put it into that syringe, and then I get another syringe, 3 cc syringe, and I'm gonna mix it up. Okay. Okay, so now it's mixed, it's a little diluted, and the reason I dilute it is so that it can spread a little easier in the temples. And so then I just insert it. Notice that I'm near the hub when I'm inserting it, and I'm below the vessels, and I'm up here near the temporal fusion line. And then I do a retrograde injection, and I can get in the supraorbital area as well as the orbit to improve the brow position. So I just sort of diffusely put it into the temple, going up to the temporal fusion line and doing retrograde injection. You doing okay? Mm-hmm. It shouldn't be that painful a procedure. Mm-hmm. And the reason I choose Defyne over Refyne, which I often do, is because she had a very large deficit. So I'm just doing retrograde technique. And it's great, this filler, because it integrates well with the tissues. And you need that in this area, because the skin is thin in this area. So I go all the way back into the hairline, and again, retrograde it, retrograde. And there should be minimal discomfort and minimal bleeding with this procedure.